I'm Paulina Leiser, producer of Focus Today. Thank you for watching this video, and make sure to check our other videos at theDove.us.
Welcome to Focus Today. I'm your host, Perry Atkinson, and what a delight to have with us today Twila Brase. She is the president and co-founder of Citizens Council for Health, and maybe she can help us get our head around what's happening with Obamacare and the increased premiums and everything. Hi, Twila. Thank you for your time.
Thank you for asking me.
Yeah. Well, listen, the president's even admitting that all of these premiums are going to go up, and yet here comes the open enrollment November 1st for Obamacare. Are you surprised by the increased premiums?
We're not surprised by the increase of premiums because all you would have had to do was look at the bill right before they even passed it to see that this was inevitable with everything that's in there. I think what perhaps the American people don't understand is that two major things are leading to, or maybe three major things are leading to this increase. One of them has to do with the fact that health plans were promised subsidies for the first 3 years that they provided Obamacare, and those subsidies were going to be paid by other health plans that had healthier patients, and they were going to be paid by taxpayers. And but it didn't work out as planned because a lot of healthy people didn't go into the exchanges. They didn't buy Obamacare, and so there wasn't enough money to go around. Another reason is that the Obama administration put the cost of covering everybody with pre-existing conditions onto the backs of people with individual insurance. And because all of those people didn't come in, the healthy didn't come in, and the young didn't come in, there's not enough money for all the people that did come in, the ones with pre-existing conditions. And then the other thing, of course, is a consolidation of the healthcare industry. Both the insurers, the big insurers, they've gobbled up all sorts of little insurers, and they're looking to merge together into massive insurers. And then the hospitals are gobbling up the clinics and smaller hospitals, and all of this consolidation means higher prices in healthcare and higher prices in premiums.
Well, the whole thing's unraveling, and it's a mess, to say the least. And again, open enrollment in November. You think it'll be a failure?
Well, it depends, I guess, on what you call a failure. I think from the perspective of what they promised was going to happen with Obamacare, it's an absolute failure. I mean, the administration is now saying that next year they'll have 13 million people enrolled in Obamacare. But the fact of the matter is, before Obamacare was passed, the Congressional Budget Office said that there would be 22 million people by the end of this year. And they're only thinking it'll be 13 million now by the end of next year. So it is in no way, shape, or form what they thought it would be. And really, that's a disaster for those who want Obamacare.
All right, so what do we do, Coach? What does Citizens Council for Health Freedom recommend?
So we recommend several things because we understand the dire condition that a lot of Americans are finding themselves in with, 30, 50, 70, some even 100% increases in their premium levels. This is unsustainable. It's unaffordable. People are trying to decide whether they're going to go uninsured and pay the penalty. What are they going to do? I had one woman say something like, my premiums went up 70%. This is like the mortgage on my house, and it shouldn't be. It's just supposed to be health insurance. And so we recommend several things. One, for individuals, particularly if they're Christians or if they have a faith or they have what they can do is they can look at health sharing organizations. And that's one of the exemptions under Obamacare. So we encourage every American to look at the 9 exemptions, which include 14 hardship waivers. And anybody and everybody can claim the 14th hardship waiver if they choose to go uninsured and they don't want to pay the penalty tax. So look at those 9 exemptions, look at the 14 hardship waivers. The second exemption is health sharing, and it's far more personal than health insurance, and it's far more affordable than health insurance. And you can find that at our website, cchfreedom.org, cchfreedom.org. And there are 3 alternatives. We have that at our website as well. But we would also like to encourage people to refuse to enroll in Obamacare. Just refuse to go into that exchange. I don't think people understand that when they go into the exchange, they are applying to the federal government for coverage. They are not getting private insurance. Your insurance card may say Blue Cross or Aetna or Kaiser, but you have to apply through the federal government. It's essentially Medicaid for the middle class on a sliding fee scale. And we know that the more people that go into the exchange, the more it helps Obamacare stay alive. And we really want the entire structure to collapse so that we can get back to freedom rather than the trajectory that we're on, which is towards single payer and government-run healthcare for all. In addition to that, we would like states to begin to act. We would like states to take back and reclaim their 10th Amendment rights. Healthcare is not something that should be run by or controlled by the federal government. And very much like they did with Medicaid and they did with the Obamacare exchanges when they said no. I think 29 states now have said no to the expansion of Medicaid under Obamacare. And 37 states have said no to the exchanges. This is what they can say for all sorts of things under Obamacare. And what they could do is start up the risk pools again for people with pre-existing conditions so that their individual insurance market comes back at an affordable level. And in addition to that, they could decide that there's going to be catastrophic coverage in their state for people. The affordable kind of indemnity, major medical catastrophic coverage that we used to have before Obamacare outlawed it. These are things that states can do.
You know, that is just clear as a bell. Thank you. That's one of the best alternative explanations I've ever heard. Thank you for doing that. The other thing is, as you know, in this political heated battle, Donald Trump says repeal, replace. Good thing. Sounds good. Can it be done?
Well, let me just say that he needs Congress to agree. And so, that might be difficult, and it depends on what will happen with Congress. But there are certain things that can be done even, for instance, let's just say whether the states act or not, they could repeal the prohibition on indemnity affordable catastrophic coverage. They could repeal just that one thing and allow this kind of catastrophic coverage, this affordable kind of care, for the car crash, the coma, and everything else to come back. And one of the things that we are telling people to do now, because they have all these high deductibles, everybody is looking for where can they get affordable health care, not insurance, healthcare, actual services. And so we encourage them to go find a cash-based practice. And so whether they have Obamacare or not, people need to find care that is affordable. And one of the things that we have started as an organization is called the Wedge of Health Freedom. And it has what we call a map of freedom. It's on a tab called Finding a Practice, and it can be found at jointhewedge.com, jointhewedge.com. And in there, we already have about 180 practices who are on a cash basis. They don't have all the bureaucracy. They don't have all the contracts of insurers. They don't have the government regulations that they're under. And so they can offer an affordable price for the care that you get. They actually have a true relationship just with you, and all your care is confidential. The data doesn't go anywhere. It's totally focused on the patient at an affordable price. So this is something that can be done whether Obamacare is repealed or not. And this is the way we intend to essentially neutralize Obamacare, even if it doesn't get repealed, that we build up this kind of direct contract outside of Obamacare, whether or not Obamacare gets repealed or not. And then eventually, there won't even be managed care if the doctors refuse to sign contracts, and all the prices will go back to pocketbook prices, and then you can have insurance on top of that just for the catastrophes.
Wonderful.
It's the way healthcare used to be. It's the way you buy everything else, through a direct contractual relationship. And right now we pay for all this bureaucracy. We pay for the data reporting requirements to the health plans, to the government. We pay for pre-authorizations and for other people to make decisions. And that's not the way it should be. It's not the way healthcare should be, and it's too expensive to have all of these other interlopers in the middle.
All right, jointhewedge.com, or you can go to cchfreedom.org and check out things there. But jointhewedge.com. Well, thank you, Twila. You are a delight. What an alternative. Let's see where all this goes, but let's just hope that the best thing people do is not go into it and let it die of its own death.
That's correct.
Thank you. Have a wonderful day.
Thank you so much.
All right. We'll be right back.